Knock, knock, knock. Can I come in?
Yes.
What's your name and date of birth?
Janet Borngesser, 13175.
Check patient ID, wash hands, provide privacy. My nurse gave me orders today to come do your respiratory, cardiac, neurological, head, eyes, nose, throat, and musculoskeletal assessment. Is that okay?
Yep.
Today we will start off with your respiratory assessment. Do you have any shortness of breath?
No.
Do you have a cough?
Nope.
We will monitor your breathing, rhythm, depth, and pattern. So I'll start with your respirations. I would check 2 times for full respirations. And then I would do it for 30 seconds and then times it by 2. Her breathing is not labored, not shallow, so it's considered eupnea. And now I will auscultate her lung sounds. Left upper, right upper, left lower, and right lower. Okay, now if I could have you place your hand right here. Now the opposite. Okay, if I have you stand up and check your back. Right upper, left upper, right lower, or left lower, and right lower. Okay, that all sounds good. And I don't have it on hand, so I'll just stimulate it. If you could hold this for instance the spirometer, you would do this 10 times per hour and in 2 to 5 seconds. Okay, good. Now we'll move on to your cardiac assessment and listen to your heart sounds and check her jugular. If you could lean back to 45 degrees and check your jugular vein. Looks good. It's not puffy or swollen. So now I will listen to her heart sounds. Aortic, pulmonic, Erb's point, tricuspid, and mitral. Okay, all of that sounds good. And I will check that for a full minute. Now we'll check the skin for edema. And I'll check that bilaterally. Same with the legs. And it looks good. And I'll check for capillary refill for 30 seconds. And then I'll check for dorsal pedis, pulse, and then ankle pocket, and make sure that's the same bilaterally. Then I'll check for femoral, radial, and brachial. And make sure that's all the same bilaterally too. And then also, if she didn't have a pulse on her dorsal pedis, I would check her popliteal, which is behind her knee. And now I will move on to the neurological assessment. Do you know where you are?
Yes.
Where are you?
Home.
What month is it?
February.
Who is the current president?
Trump.
And what brought you here?
Normal physical.
Okay, that all sounds good. Now I'm going to move on to your Glasgow Coma Scale test. This test is assessing for unconsciousness, which you obviously don't have. And there's 3 different categories: eyes, motor, and verbal response. Her eyes are moving, blinking, so that is a score of 4. Squeeze my hand. Okay, they obeyed the command and did that, so that's a score of 6. And they have answered all the response questions, so that would be a score of 5, and the normal score is 15, which she got. So now we will move on to the head, eyes, ears, and nose throat assessment. I would notice if her head is normal cephalic and palpate it, which it is. And then she has, do you have any tenderness?
Mm-mm.
Do you have any recent injuries with your head?
Nope.
Do you have any trauma?
Nope.
And have you had any recent headaches?
Nope.
Now I would move on to her ears and make sure they're in line with her eyes, which they are. And do you have any trouble hearing?
Nope.
Do you have a hearing aid?
Nope.
And do you have an excessive amount of earwax?
No.
Okay, that's good. So now I move on to her eye and also check again if that's in line with her ear, which it is. And her eye color is, of her iris is green, so that looks good. Then I would check to make sure her sclera is white and not red or pink, which it isn't, so that looks good. And do you wear glasses or contacts?
No.
And do you have trouble with vision?
No.
Okay, her pupils are round and reactive and equal in state. She doesn't have bulging eyes or abnormal movement in her eyes. So now I will assess with the light to make sure they constrict and it's a little dim in here, so it's not normal, but the normal is 2 to 4, hers is at 5, and now I will shine the light in one eye and make sure it constricts in the other. Okay, now I'll check for the other eye. And they both constrict, so that looks good. And now I move on to the nose and make sure the nose is in alignment with her face, which it is. And do you have any issues with sinuses?
Mm-mm.
And do you have issues with breathing?
Nope.
Okay, now I will fix her nasal. Could you close this side and breathe through the other? And do the opposite now. Okay, that looks good. And now I move on to her mouth. Her lips are equally aligned and colored and moist, so that looks good. I will now open her light for her dental and make sure everything looks good. Okay, that looks good. There's no tooth decay or anything. Now I will move on to the throat and neck. I'll assess, like I did before, assess her jugular vein, make sure she doesn't have any heart failure, which she doesn't. Looks good. And now I will have her. Do you have any issues? Wait, what? Okay, can you turn your head and make sure you don't have. Did that hurt when you rotated it?
Mm-mm.
Okay, now I will have her take a cup of water and pretend for her to sip it and make sure she's swallowing fine. And she is. So that looks fine. Her trachea is in midline, so that looks good too. Now I move on to her musculoskeletal assessment. Do you have any issues with joint or movement?
No.
Okay. So now I would do this bilaterally also. So with her wrist, I'll start flexion, extension, hyperextension. And now with her elbow, flexion, extension, and then this would be hyperextension with her arm going that way. I would do that bilaterally. And then I would check to make sure she can put pressure and doesn't let me. So put pressure, doing flexion, and then hyperextension. Okay, now I will do her knee flexion. She can't really do it, but hyperextension would be that way, or flexion would be that way, extension. And then I would do the same if she can do the resistance. Okay, now this way. And then I would do her foot, flexion, extension, hyperextension. Okay, that looks good. She could do that. And then I would make her stand up, close her eyes, make sure she doesn't sway or anything with her balance. So that looks good. And then I would have her take 5 steps going that way to make sure her balance is fine, and it is. So she didn't have any balance or anything. And so her cranial nerves and all that are good. And then I would document, wash hands.